embolism. One is traveling. Which one is traveling? The embolism is traveling and the thrombus is stationed. Okay? So I would know that. That's up on the top of page 303. Now this is what happens in the lungs with a pulmonary embolism. It blocks the pulmonary vasculature from the point of the embolism onward. What does that do? Okay, and what does that do?
Cause necrosis from where it's blocked from.
Okay, and the blood that's not able to get past it can't get out of the heart oxygenated to get to the tissues to supply oxygen to the tissues. So we've got a big problem. Pulmonary infarction. What does infarction mean? Huh? And it's actually more like what April was saying in the death of the tissue. The tissue past the embolism is not getting any oxygen, so it dies, it necroses. Like a myocardial infarction. What? Ask it.
Then why wouldn't it just be called necrosis? I don't understand.
Infarction just infarction leads to necrosis. They're not technically the same thing, but the infarction with the death of the tissue is going to die.
Okay, so it's not dead yet.
It is soon to be.
Okay.
And that's, part of why, it's a good question, and that's part of why when we talk about heart in BLS, what's the saying now? Time is heart muscle, time is brain. The longer you wait, the more tissue that dies and can't be repaired. So if we can catch the impairment before tissue starts dying, then that area of the heart has a chance to not have the permanent damage.
So you can fix the infarction?
When the pulmonary infarction occurs, there's going to be some death. How much? It's going to depend. If the embolism is not extracted, right then the patient's probably going to die. Yeah, this is not a good thing. Pulmonary embolisms are never good. The reason that we don't see as many actual events from embolism is the lungs actually, a lot of the little clots get through the lungs and get past and don't ever cause any problems. But it's these big ones, they get lodged and stop blood flow to an area. Alveolar atelectasis, consolidation, and this one's new to the diseases that we've been talking about so far. Bronchospasm. Well, how does bronchospasm occur with a pulmonary embolism?
Trying to protect itself, maybe?
Okay, what causes the stimulation and constriction of the smooth muscle?
Because it's irritation.
Okay, some irritation. So let's look at page 303. And Oriana. Start with bronchial smooth muscle, and it's the second line under pulmonary infarction.
You said 303.
Up at the top. It's in the first. Huh.
Bronchial smooth muscle constriction occasionally accompanies pulmonary embolism. Although the precise mechanism is not known, it is believed that the embolism causes the release of cellular mediators such as serotonin, histamine, and prostaglandins from platelets, which in turn leads to bronchoconstriction. Local areas of alveolar hypocapnia and hypoxemia may also contribute to the bronchoconstriction associated with pulmonary embolism.
Hypocapnia, what is that?
Low CO2.
Okay, why is that happening?
CO2 is that
You can't have an
re-release?
It's not exchanging.
Actually, hypocapnia, low CO2 means it's getting out more readily.
But you're not being lost.
Okay, let's look at the blood gases that have the potential to occur, and I don't see them listed here. But the patient is going to be in an acute respiratory alkalosis. With an acute respiratory alkalosis, what happens to the CO2? It goes down. Why is the patient hyperventilating?
To try to increase the oxygen supply?
Yes, because the PaO2 is low because of venous admixture. Peripheral receptors have kicked in, and along with the release of mediators, the hypocapnia and the hypoxemia, the bronchoconstriction occurs. Not in every patient, but in some patients. Oh, they are here. I missed
Yeah,
them.
it's all through
308. What'd you say, Daniel?
That's where they want it.
Now with me? That may be important because it's different. Now in this case, a bronchodilator may help because the bronchioles are truly constricted. But which is more important, getting rid of the wheezes or getting rid of the embolism? Getting rid of the embolism. So the thing is that I'm trying to get you to think about is you may come across the patient and you're not sure what's going on with them, but something from the history says, wait a minute, this could be a pulmonary embolism. And then you start seeing things come together, and acting quickly is what's going to save this patient's life. So where do most embolisms come from? They come from DVTs or deep vein thrombosis. Now let's look at some risk factors associated with deep vein thrombosis. And I'm going to go to this slide right here. It's called Virchow's triad. But anytime you have venous stasis, which is stagnation of blood, when does blood become stagnated?
I mean, you sit for a very long period of time.
When you sit for a long period of time, when you're lying for a long period of time. That's why they tell you to get up on plane trips. That's why they tell you to stop and take a break when you're driving in a car for an extended period of time. That's why you need to get up when you're laying in the bed. What if you can't get up?
They have those things that go on your legs.
They have those things that go on your legs. What are those called?
Pressure cups.